All right, let's talk about Dutasteride. This is my favorite medication because of its effectiveness for both male pattern and female pattern hair loss, which happens to be the most common types of hair loss that people have. I personally use Dutasteride myself. I use it topically, and I swear by its effectiveness, especially within the formulation that we work with our pharmacy at creating that has salicylic acid to exfoliate the scalp, allows the Dutasteride to penetrate and use lower doses, so there's less side effects. So let's get into Dutasteride. What is Dutasteride? Well, if you remember, female pattern hair loss and male pattern hair loss is caused by testosterone, but not by testosterone itself. It's caused by a derivative of testosterone called dihydrotestosterone, or DHT. Testosterone converts into dihydrotestosterone through an enzyme in the body called 5-alpha reductase. Dutasteride is the best thing we have to block that enzyme nowadays. It blocks the conversion of testosterone to DHT. That means there's less DHT getting to your hairs, and that means that you have less thinning of your hairs over time. It's not a stimulant to hair growth, it blocks the loss. However, taking away the impact of DHT on the hairs will relieve the hairs of that stress and cause some initial growth, but think about this as more of a long-term blocker of hair loss. In fact, studies show that it blocks hair loss 85% at 5 years. That means 5 years from now, you will have retained 85% of the hairs you would otherwise lost. That's pretty amazing. So it doesn't stop hair loss, it slows it down to a pretty significant degree. It can be used by men, almost all men, and by most women underneath the right conditions. It is available as topical and oral, and it's important to understand when you're going to pick each one. And we will actually talk about that briefly right now, but this is an in-depth discussion we'll have during your ACS treatments. I prefer that we take Dutasteride topically. Why is that? This is for female and male pattern hair loss. That means that it's only in certain areas, and it's easy to apply topically in those certain areas. And unlike minoxidil or Rogaine, it doesn't have to be used every day. If we don't put minoxidil or Rogaine in your topical formulation, you can use Dutasteride about every third day. And for our female clients, that means that you don't have to worry about it weighing down your hairs in between the days you wash your hairs. You can actually use it a little bit less infrequently. Male clients, of course you want to use it every day. That's the best way to do it, to maintain the highest levels we can in the scalp, but it doesn't have to be used every day. So Dutasteride in the scalp is actually very, very effective. It has very low side effect profile. But let's talk about side effects. In general, let's get to oral and come back to topical. Most people aren't totally dependent on testosterone. They're dependent on a combination of testosterone and DHT for all their kind of male hormone type things. That is, ability to gain muscle, the ability to lose fat, sleep, mood, libido. All these things can be affected by testosterone or DHT and possibly with medication. The original studies for oral finasteride, the first generation of Dutasteride, show that about 3 to 4% of men can experience things like decreased libido or erectile dysfunction. I would say that number is actually pretty understated. It's probably in the teens that people experience some effects from testosterone or Dutasteride. However, remember, it's still a low number and it's 100% reversible. So if you're thinking about trying oral, remember these studies are on oral, it's still worth a try. And if you have the side effects, we just come off or we switch over to topical. And in topical, I've only seen effects probably in 1 to 2% of my patients, but there are patients that maybe just never follow up and come off the medication with me. I just don't know about them. But I would say, admittedly, it's a very low percentage to have any side effects on topical Dutasteride. The benefits of oral, obviously, is just a pill to pop. You don't have any residue in your scalp. It's maybe easier to use. And for my female clients, a lot of times after menopause, they just don't want to put products in their hair. And taking oral Dutasteride may be the right thing for them. That is something we figure out during your treatment. However, for women who are still in family planning age, who are not to menopause yet, we usually do not use Dutasteride. It's a pretty potent blocker. 85% blockade at 5 years means that actually really knocking down DHT. There's not enough information out there on pregnancy and childbirth about Dutasteride. So we're going to revert to another medication, most likely spironolactone, for blocking your female pattern hair loss and not focus on this medication. So let's get into the program. Let's figure out if this is the right medication for you. We're going to get on it. We're going to watch for side effects and make sure that you can actually practically integrate it with your life or just rule it out, because it is really important. We do want to give it a try.